No. One, two, three, one, two, three. Hey. Hello, everyone. Welcome back to my channel. This is Isa. Easy. Today, we are going to be doing a simple thing in life in turn. So, today, we are going to be telling about everything that's going on in life and generous things. And before we do that, okay. So, before we do anything, like and subscribe my video and subscribe my channel right down the bottom in the link below. And we have a lot of things going on today. So we're gonna have a new weathercasting and everything else. And also a happy Bosses Day for everyone, all the bosses around the world. They're working so hard and everything with the schedule and everything. Also and also happy Cancer Awareness Month is coming up tomorrow. Wear a pink shirt, wear something that you feel like generous and helping other people around the world with the cancer. So let's get started with the show. So today we are gonna have a lot of things going on. There literally has been past going on for everyone. But first thing is to do is the basic. We're gonna start doing a video about someone that we trying to be helping each other with services in the community and helping each other like once. Give me 5 minutes and I'll be right back real quick. Okay, we back, people. That's what's up. So before we start with anything, any comments of anything, every year on August 17th, it's always Cancer Awareness Month. And then today is always Boss's Day, like every year. But we want to celebrate for those bosses around the world that have been helping each other and every coworker that are been having struggles and helping with work and everything else. So thank you, bosses like around the world, Baptist or anywhere. Thank you so much for that. You give me call out, helping us going through work through tough times and giving each other support and hope. That's the mean of hope. Caring each other, caring about people, and helping going work through hard and time and getting the times that right on. And we right now I'm gonna start a video about cancer awareness of today. Since tomorrow is cancer awareness month, we wanna help people that have been struggling with cancer for the whole year. And I have a lot of people that be struggling with cancer awareness. So that's why I wanna be helping people that wanted to be helpful for. And I know there's a lot of people who be going through cancer, breast cancer awareness. Sometimes it can be people be the family, and then and you feel like, oh, what is that? Like the minute to understand what is breast cancer awareness is every year, every woman for every single woman who's been struggling. There's a lot of women be getting breast cancer, and we wanted to help women around the world by going to fight together and helping each other as always. We wanted uh to have everything. So um a minute or two. I'm gonna be um that what is cancer awareness? What does it mean? What does it do exactly? So hold on a second. Hold on a second. So every year, breast cancer awareness is for women who are really struggling. They want their body to be having a problem. So let's start with the basic thing. Every 13 minutes of a woman loses her life to breast cancer, we want it to feel it for them, to be there for them. So breast cancer kills over and over 400 million women every day, every year and every day. So from 1 to 8 women will be developing breast cancer into her lifetime. And that's what we wanted to help women around the world to go through breast cancer. So you have to estimate 252 and 710 new cases from breast cancer in 2017. We want to help women around the world and helping them and supporting them all times and not being there for them. Let me see, it's not showing on my stream. Yes, okay. So we wanted to help women around the world by supporting them and helping them what are their needs to be there with their families because that's important as well. We wanted women to be there to have a good lifetime spending time with their grandson and grandkids. At a time, by time, we wanted the woman, all the women around the world, to be there for them. We want them to have support and courage of them. At, as a hospital, always know, women refusing and stress about their life and do the whole lifetime and feel like, oh, I need to do this mammogram to see if I have cancer our bodies. And we want to make sure women's health comes first than all patients. Women's first because we need women's health reconstruction right now to a new ability for women to have their lifetime. So every to 120 seconds, no, the new case of is diagnostic diagnosis. So basically, to 85% cases into occurring in a woman with no family history or of breast cancer. In there, there's 2.9 millions breast cancer survivors in the U.S. Get tested today. Call by this number. Make sure you call it, and we want to make sure women are healthy and truly helping. If you need to do make an appointment, call this number by now, or call the Baptist hotline number, and you see you will contact to your doctor or your gynecologist to help you to go through what are you been going through. Woman, if you are going through this alone, if you're in breast cancer, you know you have a life, the circumstances of being there. We want you to fight. We want you to fight on your life for your breast cancer awareness month is tomorrow. We want to fight. We want to be there for you and have support and be there for all times as well. We want it for all women to be realizing that they don't have a really a life. They wanted to be there, but we wanted for them to have a good life, have a good journey because you want to understand. What are the symptoms also of breast cancer as well?
They tried to silence him.
His name was Helmut Hoover.
He was only 16 when he saw it. His nation,
On
his
top of
church,
that,
and those he loved were falling for a lie.
Heil Hitler. He had secretly listened to illegal BBC broadcasts.
So now we're going to be talking about understanding breast cancer, including symptoms and treatments. This will be helping for women. What kind of treatment do they need for them to do?
Breast cancer is a malignant neoplasm originating in the breast tissue and is the second leading cause of cancer death behind lung cancer in the female population. Normally, the female breast extends from the lateral border of the sternum to the mid-axillary line and vertically from the second to the sixth costal cartilage. It is largely made up of two regions, the circular body, which is the largest part, and the axillary tail, which is a smaller part that runs along the inferior lateral edge of the pectoralis major muscle towards the armpit. The breast is the location of the mammary glands, which are modified sweat glands with the primary function of lactation, which is the process of producing milk. The glands have a series of ducts and lobules, with each lobule consisting of alveoli that are drained by a lactiferous duct. These ducts then converge at the nipple. Surrounding the mammary glands is connective stromal tissue, including suspensory ligaments. The breasts lie anteriorly to the pectoralis major muscle, and between the two lies the pectoral fascia, a flat sheet of connective tissue to which the suspensory ligaments attach. Between the breast and this fascia is the retromammary space, a potential space which is regularly used in reconstructive surgery. Commonly, the presentation of breast cancer is linked to disturbance in the lymphatic drainage, where lymph from breast tissue drains into the axillary lymph nodes, the parasternal nodes, and the intercostal nodes, with 75% going to the axillary lymph nodes. Most breast cancers are epithelial carcinomas that develop from the cells lining the ducts or lobules. Non-epithelial cancers, coming from supporting stroma like angiosarcoma or phylloides, are rarer. The epithelial cancers are divided into two main categories: the carcinoma in situ, where there is no invasion into the stromal tissue, and these include the ductal carcinoma in situ, which makes up around 20% of all breast cancers, is a neoplasm limited to the breast ducts. Often, this is only discovered in mammograms as part of screening. Paget's disease of the nipple is a form of ductal carcinoma in situ that extends into the skin in the region of the nipple and areola. The other form is lobular carcinoma in situ, which originates in the lobules and is bilateral in 20 to 60% of cases. The second main category of epithelial cancers is invasive cancer. This is primarily adenocarcinoma, with 75% being the infiltrating ductal histology and 10% of the remainder being infiltrating lobular. Importantly, epithelial cancers can express hormone receptors such as estrogen or progesterone receptors. Most postmenopausal cases have estrogen receptor positivity, around 80%, while premenopausal are only 20% positive. 70% of all breast cancers have progesterone receptors, and positivity of these receptors generally suggests a less aggressive cancer and are more likely to respond to hormone therapy. Another receptor is HER2, standing for Human Epidermal Growth Factor Receptor 2. Presence of this is associated with a more aggressive cancer with higher rates of recurrence and metastasis, but it does predict sensitivity to HER2 targeted therapies. Only around 12% are considered triple negative, meaning negative for all three, which features a poorer prognosis. Rarer histological types include medullary, colloid, and tubular, which have a generally more favorable prognosis. while inflammatory or metaplastic subtypes are associated with poorer prognosis. Inflammatory particularly features dispersion of the cancer throughout the breast rather than a specific mass, resulting in blockage of lymph nodes and development of the peau d'orange appearance, meaning orange peel appearance. Malignant cells can invade locally, then spread via lymphatics to regional nodes, or can disseminate through the bloodstream to distant organs, most commonly the lungs, liver, bone, brain, and skin. Many patients are asymptomatic, and cancers are detected via screening, such as mammography, showing calcifications or architectural distortions. Symptomatic presentations can include a breast mass, which is typically different to the surrounding tissue, and fixation to the chest wall or overlying skin suggests more advanced disease. An axillary mass may also be a presentation. Skin changes like thickening, retraction, scaling, or ulceration, and inflammatory signs such as erythema, as well as features like peau d'orange and breast enlargement, are other examples. In Paget's disease of the nipple, the skin changes can include rash with erythema and scaling, which may resemble eczema or psoriasis, and these changes can seem benign and therefore are more commonly ignored, leading to diagnostic delay. Other possible findings include nipple discharge, breast pain, although breast pain is rarely the sole presenting complaint, and advanced or metastatic disease may manifest with systemic symptoms such as bone pain, jaundice, dyspnea, or pathological fractures.
Are you struggling in your calculus class? Do you have a hard time understanding your instructor? Do you wish there was a simpler way? I get it. It's frustrating. You go to class expecting answers only to walk away with more questions. And because your teacher and your textbook skip.
Breast cancer accounts for nearly 25% of all new cancers in females, and the median age of diagnosis is 63. Factors affecting breast cancer risk include genetics, with 5 to 10% being thought to be linked to inherited genetic mutations, with BRCA1 and 2 being the most common. Others include neurofibromatosis type 1, STK11, which is linked to Peutz-Jeghers syndrome, and hereditary diffuse gastric cancer. Hormonal factors. There is a correlation between increased exposure to levels of endogenous sex hormones, for example, early menarche or late menopause, and risk of breast cancer, as well as exogenous estrogens and progestin through hormone replacement therapy or contraception. Other risk factors include obesity, with an increased risk of 10% for every 5 BMI points above normal. Radiation exposure, alcohol use, and reduced physical activity are other factors. The diagnosis initially may be suspected from presentation and physical exam, or may be detected from breast screening programs. Breast screening in the UK primarily involves females from their 50th birthday up to their 71st, featuring mammography. In the United States, the age range invited are 40 to 74 years. Earlier testing may be done in those with higher risk, for example, a strong family history. Imaging, such as ultrasound, is generally the first line in those presenting with symptoms, followed then by mammography. If abnormality is detected on this initial imaging, or if there is a palpable mass despite negative imaging, then tissue sampling via biopsy, with core needle biopsy being preferred. This involves analyzing histology and receptor status. The triple test, featuring a clinical exam, imaging, and biopsy if indicated, has a near-perfect diagnostic accuracy and is used especially in the UK triple assessment clinics. Genetic testing is then dependent on criteria according to the National Comprehensive Cancer Network, though some experts have recommended all cases be genetically tested. Example criteria include age under 50, triple-negative breast cancer, male sex, and family history. Further imaging, including CT, MRI, or PET, can be done if there is a suspicion of metastatic disease, as well as blood tests featuring a complete blood count and liver function tests, which are commonly done. Grading is based on the histological exam, and staging then follows the anatomic TNM staging model. But prognostic staging is also particularly done in the United States, which includes biomarker status. Management is multidisciplinary and individualized. Surgical options include mastectomy, that involves removal of the entire breast, with multiple subtypes ranging from skin sparing, which spares the axillary lymph nodes, pectoral muscles, and skin to cover the wound, all the way to radical mastectomy, which includes their removal. Breast conserving options can include lumpectomy or wide excision. In these cases, the affected breast tissue is removed and remaining breast tissue with clear margins is preserved. In both options, lymph nodes are evaluated, most commonly via sentinel lymph node biopsy. If these lymph nodes are affected, they are removed, which can lead to impaired drainage and lymphedema. Often an overlooked part of these procedures is the impact that the loss of breasts can cause. Therefore, this is an important consideration with reconstruction options then available. Generally, radiation therapy is done after breast surgery as it reduces recurrence risk and improves survival. And systemic therapy options include chemotherapy, endocrine therapy, or HER2 targeted therapy, again usually done after breast surgery. In estrogen receptor positive cases, endocrine agents like the estrogen receptor modulator tamoxifen can be used, and aromatase inhibitors like anastrozole or letrozole block peripheral production of estrogen. Chemotherapy is most commonly adjuvant, meaning following surgery, and is more commonly used in those with tumors larger than 1 centimeter and in those that have negative hormonal markers or metastasis. Many regimens are available. ACT is a common one, featuring doxorubicin, also known as adriamycin, and cyclophosphamide, followed by paclitaxel, commonly known as Taxol. Monoclonal antibodies exist against HER2, such as trastuzumab, and these are an option in cases with overexpressed HER2 receptors. In hormone receptor positive, HER2 negative patients, abemaciclib or ribociclib, which are cyclin-dependent kinase 4 and 6 inhibitors, can be introduced typically alongside hormonal therapy.
Back. Let me put myself back in. So, okay, as you guys heard, we are talking about women in general that the cancer you need mostly mom- mammogram and hold on a second. So basically, when we're talking about women in general, they're causing breast cancer due to their life intern. So that means a life intern means your whole eternity, and if you don't have a family record of for a woman that literally struggles with this is it literally struggles with breast cancer. You have a family record shows that this and this in your family is it literally shows you that that you really have breast cancer on it. But one thing or another, we want people to understand that breast cancer is serious and it's for women in general, for la mujer en general, exactamente las mujeres, nosotras necesitamos terapia o hacer tratamientos para quitar nuestras, nuestros, nuestro cuerpo. Para tener todo eso, everything else, everything we want to be concerned or anything that we feel aware of. Because the thing is, right now, we wanted to do something in life and in internet, to be precise. um to be precise in a way or two, but to make concern or anything, to be thinking about what do you want to do in life, what is the concern of it, and you want to make sure you get that percent of it, and you want it to have a life that wants to be everyone to make sure of. We wanted to have all the women around the world to listen to this. Um, one or two, um, one or two to be precise on it, and to make sure that we have good intensive care with our bodies, intensive care with for everyone. We want intensive care with people that they're really struggling of something and they wanted something back, to make sure that you will be accepting of everything from now on. Also, for all the women around the world, if you're listening to this, make sure you do a mammogram. You speak with your gynecologist and you tell them, hey, I want to do a mammogram. I don't know if I have breast cancer or not, but I want to make sure that my whole body is okay, that I don't feel like to be in concern or anything. Make sure all women around the world, todas las mujeres en todo el mundo, do your concern of way, do your mammogram in the head of due time before any concerns or anything. We want women around the world to see what they're looking for, to see what they're expecting of having, like, if you're like a pregnant mother, that you really have certified care with anything, and you want to make sure that we want it to be our best of our best, and we want it to have like anything else to be concerned, not to be precise, that we are here for them. We want to support them. And that's why breast cancer awareness starts tomorrow. We want to help women around the world to make sure that all women they need something in life to be there, to spend time with them. Don't be like encouraging them, being them or helping them, to be precise, to help them anyways. But we want women to be feel um and we want them to be there, to be precise, to help women and help everyone around the world. What are you expecting us to do? And now we're gonna listen to relaxing music and to help us to help our common anxiety. Please enjoy 10 or 15-minute break.
Communicate in English easily. Use Grammarly and feel confident with effective communication.
So I hope you guys join your live music right now. Give us a 10 and 15 minutes to relax and stress over yourselves and also stress over your life income. Like you feel like you're having too much stress right now, you feel like you're thinking too much, and this is going to help everyone to solve their problems and dreams come true. We wanted to everyone enjoy this life. So okay, guys, I'm gonna be leaving soon. See you bye, guys, in the next channel. Keep watching, live streaming, and show the fun. And make sure you subscribe to my channel and anything else, give a thumbs up and like in the channel. And please make sure we have stars and coming up and come up with anything else you need, guys. If you have any questions, please let me know in the comment below. I will literally tell you like your answers and everything. Let me know or anything else we can have fun and chat and everything else coming up. And make sure like and subscribe. And make sure you have fun and deals as well. See you guys. See you guys. Hasta la vista.